Good afternoon, everyone. We were trying to await the ambassador from Zimbabwe, um, and hopefully the ambassador will find his way up here. In the meanwhile, because we have people online also, I thought we would begin this afternoon interactive session. Yesterday, we observed the International Day on the Elimination of Violence Against Women and Girls. And I want to thank our colleagues from the Canadian Embassy for making sure that we all have our pin. It was also the start of the global 16 days of activism against gender-based violence, which will conclude on December 10th, International Human Rights Day. It is fitting that today, on the second day of that 16-day activism, that we tackle a subject that is a glaring example of the ongoing historical discrimination against women and girls. It is my honor, it is my privilege this afternoon to welcome you to this interactive session that will discuss a subject that is very close to my heart, and I know very close to many of you. Period poverty, sometimes called the pink poverty, represents a shameful systemic gender-based discrimination. I want to thank the Permanent Missions of Barbados, Canada, Malawi, the Sanitation and Hygiene Fund of the UN, and the Global Center for Health Diplomacy and Inclusion, who are the host of today's interactive session. Let me also thank Dr. Haile Getahun, who has been the shaker and mover in the diplomatic efforts to promote the right to health and health for all. 3 days ago, I published an article in the WHO Health Policy Watch on eliminating period tax. In there, I discussed how the unaffordability of menstrual hygiene products is exacerbated by both custom duties and VAT taxes that governments commonly place on menstrual hygiene products. And I called for safe, hygienic, and tax-free products to combat period poverty for all. No child, no woman, no person ever ought to be without period hygiene products. And in talking about period hygiene, and while acknowledging that today we deal with one aspect, the access to pads and menstruation products, period poverty is more than access to these products. But we are focusing today on access to the products. My colleague ambassadors and I are here because we believe that we have the potential to use health diplomacy to bridge menstrual health and trade to achieve the right to health. We're here because we believe in the Human Rights Council's resolution 47.4 that was first introduced in 2021 and made more explicit in 2024. A resolution that framed menstrual health as a fundamental component of the right to health. This is an opportunity, friends, for us to understand and discuss barriers that have prevented access to safe, quality, and affordable menstrual products from reaching low-income populations. Today, as we gather here, 800 million women and girls are menstruating. And about 500 million of them will do so unsafely because they don't have access to pads. So violence comes in many different ways. And one of the kind of violence that we see is that in the human rights treaties and covenants, it's male language dominated. We'll come back to that. Today, we will hear from the diplomatic community and technical experts in the field. We will try to identify how trade data can make a difference and how to plug into the revision process of the World Customs Organization to ensure that menstrual health products are separated from other products in the harmonized system codes. The meeting will discuss how we could engage, how we could lobby, why we must advocate to reinforce transparency and allow alignment of global standards for menstrual products. Today, we are fortunate to have with us ambassadors from Malawi, Barbados, and hopefully Zimbabwe. I also want to acknowledge the presence of our colleague ambassador from Canada. We want to go straight into this session. And I want to first give the floor to the permanent representative of Malawi to the UN, Ambassador Caroline Bwanali-Mussa. She will talk to us about menstruation products in her country. Ambassador, the floor is yours.
Thank you so much, Excellency Brother. Good afternoon. While the ambassador was speaking, I asked myself, should I start the conversation from a personal note or should I end at a personal note? So I've decided that so that I don't get so emotional, I think it's better I end with a personal note. So let me thank you all for accepting the invitation this afternoon, and also to thank the CEO and his team for hosting us. More importantly, I express my sincere gratitude for the invitation actually to be part and parcel of the team that is hosting this afternoon event, a very important event. Why is it important? Because we're going to discuss about the girl, we're going to discuss about the woman, and something that was perhaps a taboo to discuss years ago. Culturally, where I come from, Dad shouldn't even know that this thing is happening. Yet it's so natural a thing, right? So we are going to be discussing that. And the most important part also is that it is this topic with or in line or regard to the most vulnerable people in the community, the girl and the women. My sincere gratitude also goes to all partners and all colleagues for joining us today to advance this essential conversation at the intersection of health, human rights, and trade. How harmonized trade systems can unlock dignified, affordable access to menstrual products for all who need them. I forgot that I need support with my eyes. Yes, Excellencies, colleagues, menstruation is a natural part of life. Yet millions of women and girls still cannot manage their periods safely or with dignity. For too many, affordable products, adequate facilities, and supportive environments remain out of reach. These gaps undermine health, education, labor productivity, economic participation, and gender equality. The right to health encompasses the ability to manage menstruation safely, privately, and with dignity. The landmark 2024 Human Rights Council resolution affirmed menstrual health as a fundamental health right, emphasizing its importance for the dignity, well-being, and equity of women and girls. It called on states to ensure universal infrastructure. It called on states to ensure universal access to affordable menstrual products and adequate wash infrastructure, remove financial barriers, and strengthen education and policy integration to support safe and informed menstrual hygiene management. Excellencies, colleagues, it specifically called on states to eliminate or reduce all taxes on menstrual products and support those living in economic vulnerability with free or affordable options. What may seem like simple a sanitary product has embedded in it an array of trade policy issues, such as tariffs, intellectual property, trade facilitation and supply chain vulnerabilities, and technical standards which vary across countries. This affected the availability and affordability, which remains one of our most persistent challenges, because the world now, and most of the girls, our girls and women, need affordable and sustainable products. Across the world and in Africa, encouraging reforms are underway. Several countries have taken bold steps to remove taxes and improve access to menstrual products. Leadership has shown that it is possible to make a difference in that field. However, sometimes tax reforms alone have not been enough. We have seen this clearly in my country, Malawi, where in the 2022 elimination of duty and excise tax on pads and menstrual cups did not immediately translate into lower prices. Retailers often did not pass on their savings to consumers. Taxes on raw materials remained in place, consequently limiting local production. The lesson is clear. To meaningfully improve access, there is need for a coordinated and systemic approach across taxation, regulation, supply chains, and market incentives. We must align trade policy, fiscal policy, and public health priorities. Furthermore, we need to continue with initiatives on breaking the silence and stopping the stigma that has long hindered progress. Today's convening, excellencies, colleagues, is an opportunity to move from recognition to action. It is time to heed the call by the Human Rights Council made in the 2024 resolution. We have to work together towards eliminating discriminatory taxes, harmonizing and clearly delineating harmonizing system codes. And this should include dedicated codes for reusable menstrual products to ensure they are not inadvertently taxed, strengthening local manufacturing, supporting sustainable product innovation, and ensuring safer and environmentally responsible disposal as access expands. Menstrual health is a matter of rights, equity, and dignity. No girl should miss school, and no woman should have her dignity compromised simply because she cannot manage her period safely. Let us use today to build the partnership, call for policy coherency, and the diplomatic momentum needed to ensure that every woman and girl everywhere can manage her menstruation with the dignity, confidence to allow her full participation in society. As I promised to end on a personal note, when I was thinking about this event, I just recalled that I had 1 week that I couldn't go to school because it was my first week to have menses. Traumatizing as a young girl who is freely running up and down, and all of a sudden you see things are happening. And you go to your mother and tell them that, but something is raining, something is happening to me. And it says, go in, please don't go out. You get so scared and say, what is it that has happened to me that I shouldn't interact with others, I shouldn't play? And it's not because we didn't have money to afford pads, but culture. Yes, and by then I was in the village, I grew up in the village, I'm a village girl. We used to use cotton, the real cotton, not processed like in pads. So mama brings a bunch of cotton and says, can you put this on? And I'm like, where, how? Yes, then you are taken into that. But the most traumatizing part is when you're told you can't leave until you're clean. And you're like, I'm dirty? Yes, so you start grasping those ideologies, and it's very limiting. Because from there, you never see yourself as the same person who's freely running up and down and chatting and talking with everybody. So seriously, now that at least we have moved and this topic can be discussed in public and we can share ideas, I think we have really a responsibility to go beyond the talk and make sure that we influence policy and we create space that these issues can be discussed and things should be done to really make a difference, not just to talk and then it is there. So I thought I can just share a little bit of what I went through to just show, as the ambassador said, that a topic that is close to the heart, because I see myself in it. Today, yes, I do not have the economical barriers I can afford, and I can afford for my children, but still that stays with me. So I think I have got also a role to play, and that's why I'm here this afternoon to say, let's do this together and let's move our countries and our governments, all those who are responsible, let's hold them accountable. Let's push them to do the right thing. I thank you.
Thank you, Ambassador. Malawi, because of advocacy from different groups, started the process of removing taxes in 2017. Took a while, but by 2022, all VAT was removed from feminine hygiene products. This brings me to my colleague and brother from the Caribbean area, Ambassador, the permanent representative to the UN and other organizations in Geneva, and Ambassador to Switzerland, Ambassador Matthew Wilson of Barbados. Matthew, the floor is yours.
Thank you. Thank you so much. Thank you so much, Ambassador. Excellencies, colleagues, it's a real pleasure for Barbados to be here. Let me thank the Global Center for Health Diplomacy and Inclusion and the UN Sanitation and Hygiene Fund for their leadership. Let me recognize in the audience my dear friends, the Ambassador of Canada, Nadia, Ambassador of Haiti, and Catherine. And thank you to my dear friend, Ambassador Malawi, for your very honest and personal story. It's very important that we, all of us, men and women, disarm the prejudice and the shame around these issues. As you said, Leslie, 25th of November, International Day for the Elimination of Violence Against Women. And we're going to be commemorating 16 days of activism against gender-based violence. Hence, again, Canada, thank you for this lovely gesture. Now, gender-based violence has many aspects, from physical to psychological to using digital platforms as a form of harassment But preventing women and girls from having access to education, healthcare, and yes, menstrual products is a form of violence. So Barbados is really pleased to be part of this movement because I do see it as a movement, including here in Geneva now, to ensure that trade, health, and human rights can work in tandem, especially for women and girls. And at a time when trade has been at the top of the headlines for maybe not so many good reasons, it's really important to remember that trade ultimately is about people and getting the goods and services to the people that need them and making sure we meet the demand of people. Trade has to be seen as something tangible. And there's no better example of how, if trade is properly regulated, that trade can work for people. No better example than what we're discussing today. Now, as mentioned by my colleagues, Resolution 57/11 of the Human Rights Council, adopted in 2024 in July, it framed menstrual health as a fundamental component of the right to health. And it does call for universal access to affordable, safe, and clean menstrual hygiene products. It also calls on states to eliminate or reduce all taxes on menstrual hygiene management products, including sanitary pads. Now, Barbados has been among the regional leaders in advancing menstrual equity, and that should not surprise you with a prime minister like Mia Mottley. So in 2022, she announced the removal of VAT from all sanitary products as a part of a broader initiative to zero rate assess essential care items and to reduce period poverty. And this made menstrual products more affordable and accessible for women and girls across Barbados. Because we know that before the removal of the VAT, menstrual products consumed a disproportionate share of monthly household budgets, especially for low-income families. And we've had a lot of civil society agitation in Barbados who actually found that many women and girls missed out on school and work or public activities because they could not afford pads or tampons. And others resorted to very unsafe substitutes, unhygienic cloth, tissue, or extended use of single products, and this put their health at risk. So this decision on VAT was a very decisive step towards ensuring that no woman or girl in Barbados must choose between their basic needs and menstrual dignity. And across the Caribbean, the story is similar. Regional surveys show that 1 in 4 girls have missed school due to lack of menstrual products, and over 30% of low-income households struggle to purchase them regularly. In 2025, these should not be the kind of statistics that we're talking about. But there's good news. There's a lot of good news, especially across the region. Increased advocacy, increased evidence, a growing recognition that menstrual health is essential for gender equality, for well-being, and for economic participation has seen other countries like Guyana, St. Lucia, and Trinidad and Tobago remove VAT or reduce taxes on menstrual products. And these are really incredible national gains that we have got to applaud. But there's some external pressures coming to threaten this progress. Now, everyone who knows the Caribbean knows that we are extremely import dependent, particularly for menstrual hygiene products. So any shifts in global trade dynamics, production costs, supply chain disruptions, they have immediate and significant consequences on the affordability and access of these products in our region. So when import costs rise due to tariffs from elsewhere, due to factors entirely outside of our control, prices increase at the community level, potentially undermining years of progress that have been made to reduce period poverty. Higher prices push more women and girls into menstrual poverty, increases reliance on unsafe alternatives, and it can directly affect health, dignity, education, and workforce participation. Vulnerable groups, including adolescent girls and women with disabilities, and women working in the informal economy bear the heaviest burden. Supply chain fragility compounds these challenges: import delays, reduced product lines, market withdrawal by companies. These all limit consumer costs and it creates shortages. And in small island economies, even minor disruptions can have big social and economic impacts. So this is not just a trade issue. This is not just a supply chain issue. This is not just a public health issue. This is not just a gender equality issue. This is not just a human rights issue. This is a global moral imperative. So as we look ahead, I believe standardized global approaches to menstrual products are essential. Approaches that safeguard affordability, strengthen quality and safety standards, and ensure consistent access for all who need them. And diplomacy, what we do here in Geneva, what we're doing here in this room, must play a central role in shaping these frameworks. So we really join all colleagues here and around the world who are watching this and will watch this to urge for sustained dialogue with the WTO, with the WCO, and with other multilateral forums to ensure that menstrual products are clearly delineated, have clear HS codes ascribed to them, are included as essential goods, and that they're considered for exemption from escalating tariffs. This is critical not just for our region, but for millions of women and girls who cannot afford to bear the burden of trade policies beyond their control. So I was so pleased that at the last meeting of the WTO MSME working group, which I chair, we were able to shine a spotlight on this issue. In partnership with the UN Sanitation and Hygiene Fund, we were able to give a platform to a company based in Uganda, a micro company called AfriPads, who you're going to hear from today, to share their really incredible story with the WTO constituency. And I have to say, like I said, this has led to a bit of a movement, because then we had a discussion on menstrual health products in the margins of the Technical Barriers to Trade Committee. I believe we might be discussing something in the Committee on Market Access. So along with partners like Canada, the UK, Costa Rica, Zimbabwe, Malawi, and more, we are going to continue to advocate for these issues on the agenda. So I really want us to use our collective voice to ensure that menstrual health is fully integrated into global trade and quality systems, because protecting access to safe menstrual products is fundamental to protecting dignity and well-being of half of the world's population. And if that doesn't resonate with us, I don't know what else should and would. So thank you very much for this opportunity.
As you hear about how we deal with taxes and menstrual hygiene products, you'd see that these actions almost all emerged in the 21st century. Human rights and right to health movements preceded this by more than 50 years. And for me, and for all of us, this represents a genuine betrayal of trust. Women and girls have been betrayed when it comes to the right to health. At this time, I will introduce to you the permanent representative to the UN in Geneva from Zimbabwe, Ambassador Mlilo. You have the floor.
Thank you, Ambassador. Thank you for the floor. Excellencies, ladies and gentlemen, good afternoon to you all. And I also want to add my voice to this important topic that we are talking about today. menstrual issues cease to be women's issues. They are developmental issues. Inclusive development entails that women are part of it. And if we relate to what Ambassador Caroline has just said, women are left behind in issues of development, in issues even of education in some parts of Africa, because they are having to go through a natural process. And society seems not to take heed of that. So I really appreciate the conveners of this meeting, and let's amplify our voices to see that the rights of women, as far as menstrual matters are concerned, are ahead, and we call for action. Thank you. I'll read from my text. Many women and girls in sub-Saharan Africa lack reliable access to safe and affordable menstrual hygiene products. A recent study carried out by Accord and others in 2024 that covered 6 African countries indicated that the unmet need for menstrual hygiene management is very high, at almost 75% in Burkina Faso, 70% in Ethiopia, and 65% in Uganda. This confirms that access to menstrual products in Africa remains a serious challenge, especially among poorer, rural, and marginalized communities. There is a need to clear and to put policies of intervention in place, including legal frameworks to ensure menstrual products are affordable, they are safe, and widely available. I cannot emphasize enough that menstrual hygiene is a public health and human rights priority for Africa, and is clearly captured in the AU Agenda 2063. While the Agenda 2063 does not speak sorry, I was not audible. Okay. I'll check this again. I cannot emphasize enough menstrual hygiene as a public health and human rights priority for Africa, and it is clearly captured in the AU Agenda 2063. While the Agenda 2063 does not speak explicitly on menstrual products, it strongly advances the goals for gender equality, health, dignity, and education, objectives that cannot be realized without addressing menstrual health and ensuring access to affordable menstrual hygiene products. This is further picked up by the AU Continental Policy Framework on Menstrual Hygiene of 2022, where we explicitly recognize menstrual health as a human right, health, and development issue, and call on states to ensure access to affordable menstrual products. This is further emphasized by the AU Gender Strategy of 2018 to 2027, which includes measures to address barriers facing girls, including those related to menstrual hygiene. We are here to point out that inconsistent labeling requirements and complex product classifications across countries create, among other things, increases in import burdens for essential products such as menstrual products, also delays and confusion at customs points. Due to these barriers, ultimately, they raise prices and limit availability for women and girls when they need the products the most. Millions of women and girls in Africa still face barriers to accessing safe and affordable menstrual hygiene products. It's imperatively clear that harmonized labeling standards can help reduce costs, ease cross-border trade, and facilitate access to quality products. We as stakeholders need to encourage simplified tariff and import classifications that clearly distinguish menstrual hygiene products from non-essential or luxury goods. Africa is working towards meeting the menstrual products need. The sector is growing but still fragile. Such provisions on local menstrual products manufacturing sector would ensure that the cost of production on the continent is not prohibitive. Harmonized labeling rules would strengthen local industry, promote intra-African trade, and reduce the undue costs on imported products within the continent. Having improved access to menstrual products results to broader outcomes that this conversation aims to contribute towards, such as reduced school absenteeism for girls, better health outcomes for women and girls, increased participation of women and girls in economic and social life. And this can only be achieved when customs and regulatory frameworks reflect these gender realities. As the coordinator of the Africa Group on Health, we look forward to a continued dialogue, adding our voices to this process and to work collaboratively with the stakeholders to achieve safe, affordable, and accessible menstrual hygiene products for all women and girls on the continent of Africa. I thank you.
Thank you very much, Ambassador. We've heard from 3 ambassadors, and in each instance, soon after or during the period of COVID-19, that were removed in all 3 countries. There is, in fact, a growing number of countries where taxes are being removed, but it still represents a minority of countries. And whilst VAT is being removed in many countries, not all taxes are removed. There are other kinds of taxes like excise tax, etc., that are still applied, and we need to address that issue. In 2008, as Minister of Health in Guyana, we ensured that all feminine hygiene products were VAT-free. In 2017, the government in Guyana made it 0 rated. It's a big difference. It is today again, is VAT-free in Guyana. But early this year, the president of Guyana declared that feminine hygiene products are exempted from any kind of tax. So there's 0 tax on feminine products. In 2020, the First Lady of Guyana became an advocate for access to menstruation products and for improving infrastructure to support girls and women during their menstruation in all public places. Girls in schools, including the university, now have access to free hygiene products. I believe that is true in Barbados also, and several other Caribbean countries. The health centers today include menstruation pads as part of the national formulary. That is the medicine and medical supplies list of things that the public health sector is supposed to provide. Incidentally, for schools, that include both public and private schools. And a growing number of of schools, of countries are in fact doing that. And this is because there is also growing advocacy. So NGO movement, and indeed legislative action. Scotland became the first country to make laws legislatively to provide free menstruation hygiene products in public places. And before I move on, I do want to highlight the brutal conditions when it comes to female hygiene in prisons and in refugee camps. We do not sometimes recognize that this is a dire need. This afternoon, in addition to the ambassadors who are here, we also have some experts in their field. One of those experts is a menstrual health market specialist, the UN Sanitation and Hygiene Fund, Mr. Adrian Dungas, and we'll give the floor to Adrian.
Thank you very much, and I would thank all the ambassadors for being present today and adding their voices to this important topic. I would like to thank all the co-conveners for organizing this session today, and I believe some slides will be shared. In the interest of time, I will get started. What I would like to do on behalf of the United Nations Sanitation and Hygiene Fund is give a brief overview of the scale of what we are talking about and setting menstruation not only in the context of the lived experiences of every second person on Earth, but also recognizing that managing menstruation in a dignified way requires looking at the system that provides these products. And that is a global system of trade, of manufacture and enterprise that has provided a significant share of the world with quality products for many decades, but it also has fallen short on a large group of women. And as Ambassador Wilson said so rightly, I think we can do better. So when we look at the issue of menstruation, I believe, yes, we are moving up. Thank you very much. You can move to the next slide. You have heard in many different ways a statistic pass us by, but I think it is important to stop and look at the fact that every second person on Earth will require a menstrual product for at least 35 years of their lives. To be participating in school, in work, to be here at this meeting today, it is an essential piece of participation in our societies today. And when we look at that issue for low-income users, for low-income women and girls, on the next slide, you'll see that there's well over 600 million women and girls who today still rely on what we classify as non-purpose-made materials. Many of the materials that can be found around us, from old mattress foam, old clothing, something, because women and girls will find something to manage menstruation. If we are not capable of providing them with a safe and quality product that they can rely on, not one day, not 1 week, but every day and every week and every month. And that picture is diverse. On the next slide, you'll see data from the Global Reproductive Health Supplies Coalition. And again, the stories shared today by the ambassadors are examples of how this issue comes to life in so many different parts of the world, from the perspective of an individual and from the perspective of the systems and the governments that we represent. So please move to the next slide. But across the world and across these regions, well over 1 in 3 individuals is still struggling to manage menstruation. And the nuances are there. We heard the numbers about Ethiopia and Uganda. If we look at the Latin American continent, if we look at different parts of South and Southeast Asia, even 1 in 10 or 1 in 4 girls in the classroom or women in the workforce. It's a very significant part of society that is hindered by not having access to such an essential product. On the next slide, you will see that the system, the enterprises that are trying to make menstrual products available are doing that today for a large number of individuals. Products are manufactured in many different parts of the world in massive factories. There's huge economies of scale. There's a lot of competition. We can say that when we look at the industry providing the single-use menstrual products, such as pads and tampons, they've gone about as far as they can in trying to make these products available as economically as possible. And there are still improvements. I think that in the world of trade, tariffs, and value-added taxes, there is improvements to be made. There are improvements to be made in how we trade these products and how we can make sure that not only within countries, but among countries, there are regions where we can trade these products collectively. But the price point for these products is not expected to drop significantly. The raw materials that are used to these products are currently subject to immense pressures due to climate change. We expect raw material prices to increase quite significantly in the years to come. And at a price point of, depending on the country, somewhere between $20 to $25 per user per year. And for island states, I might recognize these prices are significantly higher. This puts this product category significantly out of reach for a large part of the population. And that means that we also need to look at the progress that we've made in other areas. On the next slide, you'll see how innovations in recent decades have changed the landscape of menstrual products drastically. We have fantastic companies that are looking at making single-use products available in a way that's also more environmentally sustainable. But these are only starting to scratch the surface and haven't reached the masses yet. We see reusable menstrual products made from medical-grade silicone, some of the safest materials in the world that are used in heart valves and in fake hips, now being applied to menstrual products. We see cloth-based products that my grandmother used. I heard examples of traditional cloth being used to manage menstruation, but now with the advancements in material science, we're using high-performing textiles to make products available. And these products are being used by a growing number of people because of improved use, comfort, concerns about health or the environment. But what's really important to note is how they fundamentally shift the cost and the burden on the individual. When menstrual cups, as an example, and it's just one example, were introduced in its current form about 10, 15 years ago, the price point was somewhere around $100 for purchase. That's not an accessible price for many. Today, these products are produced at around 45 cents, and we see them in retail available for individuals for about $5 a piece. Yet these products can last an individual between 5 to 10 years. There are products available today for some consumers that can cut the cost of managing menstruation by a factor 10 or more. But what is the reality? That these are not available for low-income users. So we have the lowest income users in the world are in a position to only buy the most expensive products that are on the market. And that is something that we can change. On the next slide, what you will see is that the best research that we have also shows that people want to use these products. There's a lot of interest to try. And it is our responsibility to make sure that they're available and that they're safe and that they're regulated. But the barriers that exist to bringing these products on the shelves where people do their day-to-day shopping, so that mothers, daughters, but also fathers, husbands can buy these products for their families, those barriers need to be addressed. And there is a role for Geneva to play in that. On the next slide, you'll see a few examples from standards, taxation, but also support to private sector and making sure that predominantly women-led, not just, there are many passionate men in this industry too, but a predominantly women-led industry has access to the financing that they need to bring these models to scale. And that all boils down to what I mentioned earlier. We need a better approach that allows people to buy the products that they want to use and that they can afford in the shops close to where they live. Please move to the next slide, and one more. I would briefly like to also talk about the potential. We're not just doing this out of charity. If you sit across from people who are not interested in doing social good, please tell them about the economic opportunity of working in this space. Half the world's population consuming a product means a market that is worth taking seriously. Today, in low and middle income countries alone, the annual value of the menstrual product market is $28 billion US. A market with users that are going to grow by 9%. That means 161 million additional consumers on a market so ready for a quality product they can afford. So there's a lot of convincing arguments to be made to include private sector and to attract the additional investment, trade that is needed. In the context of Geneva, please move to the next slide, there are two areas that are really worth pointing out in a bit more detail. The first one is the work that's happening globally in developing ISO standards, international standards for menstrual products. For those of you who are not aware, ISO standards exist for almost everything, from the air we breathe, the bridges we walk on, the food and the water that we eat and drink. They are all governed by menstrual products, yet, by ISO standards, yet menstrual products do not have an ISO standard yet. And it's caused all kinds of challenges, challenges in importation, challenges in ensuring quality. And it's been one of the barriers that has prevented new innovations from reaching users. If we move to this next slide, please. Yeah, you can keep going to the one on safety, please. One more. Yes. So there's a real compelling argument to work on standardization from the perspective of enabling a market to function well. But what we've also learned and what was shared at the TBT committee is that there is actually growing research now on the contamination of menstrual products. There is growing research that shows that there are heavy metals present in nearly all the menstrual products that are on the market today. Because we have, in our current form, our standards have only safeguarded the performance of products. There are no long-term health and safety requirements for menstrual products for standards anywhere in the world, with the exception of menstrual cups. I would like everybody to really let that sink in. If you want to know more about this initiative, for the sake of time, I'd highly recommend speaking to the secretariat from the TBT committee, because there's a lot of work that was covered in the session 2 weeks ago. But there's a large community of countries, over 55 today, that's working on developing these global ISO standards. We have delegates from Ghana here, whose National Standards Authority is the co-secretariat for this global TC committee, and will be hosting the next meeting in Accra in April. So there's a lot of work that's ongoing. I would encourage countries who have not yet participated to please do so, and we can share more information after the session. If we move by another slide, please. Yes, thank you. I do like to point out that finishing ISO standards and publishing these, expected to be ready in 2027, will only be the starting point. We're trying to pull together the organizations responsible for this work and make sure that when we get to a global ISO standard, there is also the publication and then the adoption at country level. And I think that this is absolutely essential, because without adoption, safety requirements and performance requirements will not be binding. And it should not matter where you are born, whether you have the luck of being able to buy a product that is governed by ISO standards and by safety requirements. More information to follow. I think the initiative that we will go into in more detail today is concerned with the work around HS codes. And why are these so important? Could you please move like 2 slides? The reason that these are so important is because on the one side, we need to improve the data on this market. We need to better understand how products are or are not reaching individuals, and HS codes played an essential role in that. The current data is extremely limited, especially for low and middle income countries. We have poor insight into the actual gap of product access, and the efforts to collect data on menstrual product use and availability are extremely expensive. A revision of HS codes would make data on menstrual product use by product category at national level available freely for every country in the world every year. It would provide an opportunity to align ISO standard and quality certification with the classification in customs cross-border trade. It would ease trade, it would support quality assurance, and it would make overall efforts for making safer quality products available easier for countries. For those of you who are not familiar, on the next slide, there is an example of how HS codes are broken down. It is a fairly simple system of 2 digits that will help us classify products and goods. And the example here of an apple, I think, is quite telling. We are currently working with different experts, customs authorities, with thanks to the great guidance of Canada, and trying to figure out what the best way is of revising the HS code classification. Because as you can see on the next slide, menstrual products today, while being used by so many people, don't have a dedicated HS category. Single-use products are grouped together with diapers, wipes, and other tissues, making it very difficult to even understand the types of tariffs that these products are subject to, because they're not broken down across the different categories. And the other innovations don't have a home today. They need a home, they need to be classified so that we can assure quality, understand the tariffs, and track their trade across borders. And the great news is, on the final slide, you will see that we have a global system for this. With the World Customs Organization, every 5 years, there is a process for revision of HS codes. And there's a role for the community in Geneva to play to do that, something that Canada has led actively, and I would leave to the Canadian delegate to speak about that. Thank you very much.
Thank you very much, Mr. Dungus. I'm sure that many of us in this room and many of us online have learned much during that short presentation. In fact, it is a huge market. In developing countries in 2024, as Mr. Dungus said, it's about $29 billion, and it's expected to grow as we make it possible for more girls and women to access these products. It's expected to grow by 2030 to about $44 billion. And so this brings me to efforts being made by various organizations. One of these organizations that have played an important role in improving access to menstruation hygiene products is AfriPads. AfriPads has been a lead organization in making access to reusable pads. It will be good to hear their experience and the work they have been doing in Africa. So I want to invite the representative from AfriPad to make this presentation.
Hello, my name is Michelle Cheng-Villink. I'm the CEO of AfriPads. I'm recording this today for you from Côte d'Ivoire since I couldn't join the meeting live. So thank you, Adrian and Sanitation and Hygiene Fund, and to everyone there in the room for allowing me to share a little bit our story. In case you don't know, AfriPads is one of the largest manufacturers of reusable menstrual products, or reusable sanitary pads on the continent of Africa. We're based in Uganda. We are indeed a social enterprise, so we're registered as a company, as a regular for-profit company, but our profits go back into the business to provide for the 100 colleagues that we have, good working conditions, the rural factory, and into training, education, data collection, and when we can, donation of certain products to give back and put back into the mission of reaching as many girls and women as possible with high quality menstrual products and information about menstruation. So I'll just tell you a little bit more, a few more details about AfriPads, and then I will address our experiences with trade as a company that exports a good number of our products every year, and what we see as things that work and what challenges and barriers we still have. So the reason that we feel like AfriPads as a company works is because we've always had the focus on highest quality possible, for the most affordable price. of reusable menstrual products, so sanitary pads and now underwear, and we make a few other items. And due to the fact that we were able to scale up over time, then this quality and this speed and this low lead times is what made our very strategically placed factory in Uganda extremely reliable and supportive to our customers in the region, given Uganda has a good base for overland transport in several countries where there's a lot of humanitarian need. We have a highly skilled, women-led workforce, and we have a very financially sustainable model, as well as the sustainability of the reusable product. So just very quickly, this is what it looks like. We have the AfriPads brand, which you see there at the top, 4, 5, 6 packs. And that's the one that we mostly sell B2B to NGO customers. And often then the end user, the girl or woman, receives the product for free. And then you see in the middle there, we have a Sosure brand, the consumer brand, which is retail in Uganda, as well as of next year in Kenya. It's cost effective. Of course, it reduces waste from disposable products. And because it lasts for 2 years, so just going back to the cost effectiveness, that makes it about 7 times cheaper across 2 years than a lot of disposable products, at least in Uganda and Kenya. We were founded in 2010, so we're now 15 years old. In the meantime, we built that I mentioned, a very large scale factory. We can make 90,000 to 100,000 kits per month. And I don't have it top of mind, but we also make underwear and can produce a high number of underwear per month. We've created hundreds of jobs over the years, specifically in a high percentage for women. At the moment, more than 83% of our employee base are women. We've reached 7 million women and girls across 40 countries in the last 15 years. And one of our main focuses is that if you tackle menstrual health, then girls miss far less school, more likely to graduate, more likely to continue to be financially active, economically active in work. And so we always track that in terms of school days. So we've given back more than 20 million school days to girls. To give you a sense of our scale so that you understand what we're talking about as well when we are discussing trade and trade barriers. Annually, on average, we produce about 700,000 kits, so full packages, to about 180 customers. This reaches somewhere around 600,000 women and girls. Depends per year, but usually we export to about 15 countries across Africa, train thousands of people. We have 3 to 5 production lines for the pads and underwear at any given moment. We employ approximately 95 people. Like I mentioned, 83% or more are women. And everything is produced and exported from our one factory in Uganda. We export approximately 75 to 85% of our products, depending on the year, outside of Uganda, but we do import our raw materials. So just here to a sense of our operations. We import our raw materials for cost control and quality and consistency, but then everything is produced in Uganda. We also have a small office in Kenya and Zimbabwe, as well as stock warehouse in those countries and in Zambia with sales reps, and we're continuing to expand that. We primarily ship direct to the customer. And like I said, mostly what we call B2B sales, which is ultimately selling to the UN organizations and NGOs where the end user receives it for free. But we do have a small retail arm in Uganda and in Kenya next year. Our core focus until now has been Eastern and Southern Africa, just due to reach. if we would like to significantly expand in a deeper way across the continent, but it takes some real investment in stock, local colleagues, and a better functioning trading bloc, and tackling the cost of overland travel or the length of time to ship by sea. So when we talk about trade, so as I mentioned, we export a good number of our products. Now, some of that is simply crossing the border into Kenya and into Goma, so just across the border here from Uganda. But it also is the import of raw materials as well, and farther afield that we send our finished goods. We started to import raw materials around 2013, and we were exporting already from 2012. So pretty quickly in our journey, we were dealing with import-export. So a few things we wanted to point out today in this presentation, which hopefully will be of interest to you. The number 1 and 2 that you see on your screen now are very related, but testing and standards in general for menstrual products are 2 huge topics and have a big impact for us with trade. So I'll start with the testing in this case, but the testing of reusable menstrual products, there's no standard or one gold standard or one standardized testing method, and sometimes we see, and due to that, we see sometimes customers testing for themselves, or each country that we export to has their own test methodology and standards. It usually relates to a few categories. So absorbency over time, or instant absorption. So how quickly does the liquid be absorbed right away? And microbiology counts, so bacteria counts. And because there's this lack of the global standard, and we're not the only one making quality menstrual products, quality reusable menstrual products and reusable sanitary pads, but the version that we have is not the same, of course, not the same exact product or the same exact functionality as another company, and and so you just see a lot of discrepancy in the different kinds of fabrics or what we use as to the different test methodologies. So how high is the liquid up? How thick is the liquid? How relevant is that to the user experience? Because for us, that's the number 1 most important aspect. So because there's not just this standard, then for each country, we can really encounter challenges as we try to export. You can get disqualified this time and not the next time, etc. It just goes on and on. So in order to get a lot more consistency in our export business and within our own trading bloc in East Africa, we really need standardized testing. I say that with one caveat, also within reason, because certain tests can be quite costly or prohibitive in cost. So we as AfriPads, for example, identified 3 or 4 key bacteria that absolutely you should always test for that, or absorption over time, for example. And but ideally you have this global or regional standard that's accepted, that's used by all, and that also allows you to get registered and not have to test every time due to the high cost. Related to that is just in general, there is not a global menstrual product standard for import-export. So that's something that is being worked on right now. And one of our colleagues is also part of the working group on behalf of low middle income countries for this ISO global menstrual product standard. But as it is, it doesn't exist, and it varies greatly then across borders. Again, including in our own EAC and Kenya, Uganda, Rwanda trading bloc. you see everything from different specifications about the performance, but also textile specifications or the type of packaging used. And for example, you have in certain countries, specifically Nigeria and Ghana, it needs FDA approval or it needs to be listed as a medical device. So all of this inconsistency as a small, medium-sized company makes it unpredictable, which is hard for our business and hard for our customers and can also affect price. And then lastly, and hopefully my video screen isn't covering too much there, because the HS codes for the movement of menstrual products is often lumped into the same category as diapers or other types of hygiene products, amongst, frankly, many other things. It's really hard to get enough data to understand the true movement of menstrual products and where is there a lot of demand or a shortage or a surplus. It would be extremely helpful and interesting if that public information from the HS codes could be a little bit more disaggregated. So, I mean, in the most ideal world, that would also be for specifically reusable menstrual products as a separate or sub HS code. But ideally, in general, just if there was one that separated away menstrual products, this would be really helpful for us to have more market insights. So, this as a closing thought, what we're really trying to share today is, you can imagine as a small, medium enterprise, especially one operating out of Uganda, so out of an LMIC country, it's quite taxing to when we have to go it alone. So just as an example of things also AfriPads has done over the years, and what we see is we're already shaping the market of reusable menstrual products. Until now, a huge chunk of the market share is for disposable products, but we see a lot of value add and cost efficiency for the reusable products, but you have to really do all of that awareness and education yourself, as well as talking to each individual country about removing import duties for raw materials for local production, or removing import duties on VAT of menstrual products within a country. This is something AfriPads successfully lobbied for, partially as a partner in Kenya, but also then in the lead in Uganda, and for at least VAT removal in Malawi. There, I think, now are 7 or 8 countries across Africa who have removed a number of import duties or VAT on menstrual products, but there's so much more to go. And so that has a huge impact on our ability to do business. And if you're having to lead the way then on those taxes, dealing with each individual tax authority, each individual standards authority, etc., it is a big load to carry as a small company. So this is where we feel like this awareness with World Trade Organization, with governments around the world, to really see what kind of challenges we're up against, even within our own trading blocks. We think there's a few simple things that can be done together to really improve the ability of, improving access and affordability of menstrual products across bigger regions, and allowing small and medium enterprises or social enterprises like ourselves to really grow. So thank you very much for your time. And if there's questions, I think Adrian also knows quite well. Thank you.
I know we're running out of time, so I'm going to go to the last presentation. A number of colleagues here from the embassy, from the Canadian Embassy, and one of them is Lisa Malin, who will talk to us about efforts at the WTO. Lisa.
Thank you very much, Ambassador. I will try to be brief in my remarks. Earlier, the Ambassador from Malawi, I think, highlighted the importance of creating space. So I'd like to recognize Ambassador Wilson's efforts for bringing the SHF and AfriPads to the WTO. This was an aha moment for me for a trade policy perspective. If we can go to the first slide, please. As a proud Canadian, I'd like to point out that one of the founders of AfriPads happens to be sitting next to me, and she's visiting us from Nairobi today. So we're very, very pleased to have Sonia in our presence today. So thank you. I think we've heard so eloquently from our ambassadors on the imperative to menstrual health, the imperative to reduce barriers, and how we can work collectively in the need for us to go from recognition to action. And for me, this slide is kind of that puzzle piece, telling us exactly what we can do together and how we are uniquely positioned in Geneva to move the conversation forward. So in category, and you can see in the bubble 1 and 2, it talks about standards. It talks about the need for testing, for global effort to work towards safety standards, and the ISO is doing this. And as Ambassador Wilson said, there's momentum within the WTO. We brought the presentation, the ISO presented to the members of the Committee of the Technical Barriers to Trade, SHF as well, and the doctor at Columbia University who's doing this incredible work to figure out, the contaminants in menstrual products. People left that room from that presentation that day shocked, surprised at the findings and the fact that there's a lack, or inconsistent or complete lack of standards. But there was something really positive that came out of that presentation. And at the end of the discussion, there was an idea to put forward a proposal for all the members of the WTO, 166 of us, in the Committee of Technical Barriers to Trade, to talk about menstrual product standards and to have a conversation as a group of technical experts. So sometimes, I personally love this. We're going from technical barriers to trade to technical bridges to trade. So I think collectively that's something we can do. It's a very tangible action. We can bring forward a proposal, the Committee of TBT, to have a thematic session, and that can bring forward our experts and all these incredible stakeholders to share with us their experience and expertise. And then the third thing here, to me is like, how is this possible? What does this actually mean? So we can move to the next slide. So I asked the wonderful secretariat, the WTO Market Access Secretariat, to pull trade data for menstrual products. And I go, this is what we found. That's fascinating. So baby diapers and menstrual products are all lumped together. And we have no idea if it's 10%, 50%, 90% diapers versus menstrual products that are traded globally. There really is no granular data. And why is this? This is the next slide. The answer is it's a structural issue. It's because the current harmonized system only has a heading. And in this heading, pads, menstrual products, and baby diapers are grouped together. And so this is a conversation that we can bring to the Committee of Market Access at the WTO and say, hey, look, this is a little strange. This is an opportunity for us to say, what are your experiences domestically, at the national level, at the regional level? Canada, for example, has further disaggregated to 8-digit codes. So we've taken the time to separate baby products from menstrual products. And we're not the only ones. Other countries have done that too. So perhaps this is a moment for us to come together and talk about our experiences, what's worked, what hasn't worked, and what we could do collectively at the Committee of Market Access to make potentially a proposal to the World Customs Organization to say, hey, look, this is what we see. But, and Ambassador Wilson's word, we can do better. And I think that comes from experience sharing, technical expertise sharing, and asking all the questions, because the window is now. We have an opportunity to make suggestions to the World Customs Organization. The review for the harmonized system happens every 5 years. And right now, the window like, we are very, very lucky to have the opportunity to have a conversation and collaborate with the WCO to be able to provide the data and disaggregate the current structure at a global scale, because every member, over 200 members of at the national and regional level, use this harmonized system for everything that is traded. So if we go to the next slide. So on a practical level, Canada, with Barbados and other partners, have put forward a proposal for a thematic session to do just this. Let's talk about it. You know, please share with us your experience. What can we do better? What can we do differently? And then based on that experience, I think maybe we can make a systemic change. So I invite everyone to, you know, this is a public document. We've made it public for everyone and anyone to be able to see. And we think I think now is a good, better late than never, but heading into 2026, I think we have some good momentum at the WTO to make a difference. And, you know, I think to move from recognition to action. So thank you.
Thank you very much. And Guyana would join you in that. We have had some insight presentation this afternoon. I want to recognize the permanent representative of Zambia, who is with us, and I will give her an opportunity to make a short intervention.
Just one thing. Thank you, Chair, and I must apologize first of all for coming in late. And because of coming in late, of course, I've missed out on the presentation of my three colleagues. But I do have a very, I have a passion for this subject. I don't know what they presented, but I do know that in our areas, especially in Africa, most girls have a problem when they're having their mens because they do not have the right pads to use during that time. And that has affected their education. During the time when they're having their mens, they don't even go to school sometimes. So it's good that you're bringing attention to this subject, especially to organizations such as the WTO, so that those that put duty on those goods can maybe think twice or three times about it. So I'm happy that you've been discussing it. I have seen a bit of it, and I think that it's good that it's under discussion now so that we can help the girls in the rural areas, especially those that are not able to afford those pads. So I thought I should just make that very short intervention. Thank you very much. And congratulations to the three panelists.
Thank you very much. Colleagues, I will have to skip the opportunity of having questions. I do want to assure everyone that the slides that we use today will be circulated. Our colleagues from CeHDI will make sure that that happens. In the presentation, a number of recommendations came through, even if they were not made as recommendations. And even though I will summarize those in bringing this session to a close, we will work together, the ambassadors with CeHDI, to make a formal set of recommendations that came out of this session to circulate to our members. But we heard the issues. We have discussed these efforts that are being made across the globe to ensure affordable access to menstrual products by those who need them the most. Today, in as much as we celebrate the gains made, we came together to address the issue of disaggregated classification of menstrual products to ensure they are correctly categorized for taxes and trade statistics. Having specific harmonized system codes for menstrual products will enable us to understand product flow and assess supply gaps and any vulnerabilities in the process. At the end of the day, we would like to be able to target interventions accordingly. And so, in bringing this meeting to a close, I want to implore, or we want to implore, that we put our weight together, we work collaboratively together, lobbying the WTO, and engage with the World Customs Organization to ensure specific categorization of menstrual products as essential products. I think that recommendation is quite clear. That we lead or support work for removal of taxes on menstrual products, not by some countries, but by all countries, and not just VAT, but all taxes. To support initiatives towards free access of menstrual products for those who need them. It was done with condoms, and I believe if we push the right buttons, it can also be done with menstrual products. It is high time we do that. We must do it now. We've heard the call for ISO standards and HS codes. These are critical elements in the movement to ensure universal, affordable access to essential products. And so the diplomatic community here in Geneva will work with all stakeholders to make sure that commodities necessary for period health is no longer an impediment. To use Ambassador Matthew Wilson's word, it is an imperative. And it is one of the deficits in the right to health that I believe is doable now, even with the resources that we have today. And so the 2030 SDG and particularly for SDG 3, but also linked to other SDGs, such as environment and water, the right of women, that at least making menstruation health a right that has been achieved by 2030 is something we can do. And the movement that Ambassador Wilson talked about starts in this room. Adding to the movement, there's lots being done. Legislative action is necessary. And so we will approach the IPU too. That parliamentarians must become involved. In the meanwhile, there is an active initiative in the judiciary to make menstrual health a right for all. We see that in the early 21st century in Colombia, the court ordered governments to remove taxes. And presently, there is an interesting case in Pakistan. So the judiciary is being engaged in this process. Colleagues and friends, this afternoon was more than just highlighting a major deficit in the right to health. It has highlighted a genuine betrayal of trust. And this afternoon, we commit to end that betrayal and end the historical discrimination that is sex-based. I want to thank you for coming out this afternoon. I want to thank all those who joined us online, and especially my colleagues from the Ministry of Health in Guyana. Look forward to be with you soon, and we make sure that no girl, no woman, no person who need these essential products in Guyana and around the world will have to have their hands outstretched. It is a right, and we have an obligation to deliver. Thank you all very, very much. Thank you.